Welcome back to Mental Health Matters. We're joined again today by Sally Mink, who is the Special Program Coordinator for DRADA, which stands for the Depression and Related Affective Disorders Association. Prior to the break, Sally, you were talking about the kinds of programs and projects that your organization offers and provides. Can you say a little bit about some of the activities that are involved with the support groups and some of the peer support projects that you have going on right now?
Sure, I'd be glad to. Support groups, as I mentioned before, we feel very strongly about helping not only the patient but also the family members. We have over 80 support groups in the Baltimore, Washington, Virginia, Pennsylvania area. We actually even have a couple in Ohio and New York. The support groups, for the most part, are for both the patient and the family member. I would say maybe 80% of them run that way, so both patient and family member can attend. We have a few that are designated just patient or person with the illness only, and some that are designated for family members only. Some people feel funny about complaining about their loved one in front of them, so there are people that feel strongly about that. We actually even have at least one group in Washington that is for what we call young people, and that is older teens, college students, young adults who feel more comfortable with people their own age rather than an older group. And those support groups meet, some of them depending on what area, who's the support group leader, some meet once a week, some meet once a month, some twice a month. So they vary according to the support group leader. The support group leader is trained at Hopkins for an all-day session. And the support group leaders, to my knowledge, all have the disease themselves. So they know how awful things can be. And there's also often a co-leader, so if one's not feeling well, the other one can, pick up.
What's the goal of the support group? What are they trying to accomplish?
It's called mutual help support. It's trying to help one another. It's not therapy per se, but talking over with other people what it's like to live with the disease. What are some good things to do to help yourself, things not to do. They don't get into clinical issues about side effects and that sort of thing, because one medication might affect another person another way. But basically just to help one another. And I think research proves, particularly in breast cancer, that support groups are vitally important and make one's life easier if you can talk.
So you're really talking about a situation in which people that share a common bond of trying to manage a disease process are able to share their experience, perhaps learn from the experience of others, get emotional support, not feel isolated and alone, maybe hear about some coping strategies that have been effective for someone else, that sort of thing?
Absolutely. If you've never had depression, then you just don't understand it. It's like any other disease. If you haven't suffered from it, it's really difficult to describe. And I think that's one of the tough things about depression is you don't usually see it. If somebody broke their arm and had a cast on it, you would open the door for them. But these people often suffer in silence. People tell them to pull themselves up by their bootstraps, or if they tried just a little bit harder, if they prayed a little bit more, things would get better.
Well, this is one of the, I think, really important issues in terms of people who have depression, often that being seen as a character flaw or a weakness rather than a real medical disease, and that falsehood persists in spite of all of the efforts, in spite of all of the advancement, in spite of all of the educational programs that there are out there, that we still have not accepted depression and other mental illnesses like the real illnesses that they are.
I would agree with that. I also want to mention that we have something called peer support. Now, everybody doesn't like to go to a group, a group situation and talk about their personal lives. So we have peer support that is sort of an adjunct to support groups. And what we do is we profile people over the phone. We have somebody that's in charge of that. So, people with similar interests, similar diagnosis. So if they're having a bad day, they're each supporting one another. This is just, not one-sided. They can call each other, they can get together for lunch, or they can just talk by phone, they can email, and just talk about having, a tough time. Rather than waiting for the support group that's 1 month away, or the support group that they might not be interested in, or a lot of people don't want to travel late at night now. So the peer support, I think, is very helpful.
So that's a way to kind of have, for want of a better term, a buddy or buddies that you can kind of reach out and grab a hold of when you need the support.
Extra support.
I see. Huh. Okay, that sounds like a really creative approach.
Well, we're trying to help people on all kinds of different levels. So,
Now let's talk specifically about kind of getting back to, you talked about some of the adolescent issues in terms of depression, irritability, and some of the other things that we think are just sort of part of normal adolescence, but in fact can be part of a cluster of symptoms that really indicate that the youngster is depressed. What are some of the special kinds of projects that you're involved with for adolescents?
Okay, we've just completed a film called Day for Night, and it's an interview of 6 adolescents who had suffered from, or who are suffering from, clinical depression or manic depression. Males, females, it's ethnically diverse. And I always say depression comes in different flavors. Some of the kids turn to drugs. Some of them had eating disorders, which will often overlap, not always, but often overlap with a depression, like bulimia and anorexia. It's really, if I may say so, a really moving film, and I have to give credit to the kids that were courageous enough to come forth and do this. We're planning to, we've written a teacher's guide that will be inserted into the film, and we're hoping to send it out to 23,000 schools. We've just gotten a grant to go into 8 schools in the Baltimore area, and I'm saying area. There is a school, Severna Park, which is one of our intervention schools. Unfortunately, they've had 2 suicides in the last 6 months and 4 suicides in the last 2 years. So we're trying to get into schools that want us to come, that know about depression, that we don't have to do a whole lot of training, going through red tape. So we have 8 schools, 4 are intervention and 4 are controlled.
I see.
With the controlled schools, we're going to go in like we usually do and give 1 lecture. With the intervention schools, we're going to give 4 lectures to the kids. And I don't like the word lecture because it's going to be interactive.
Sure.
4 sessions with the kids, 3 sessions with faculty, and 2 with parents. So 4 of those schools will be getting 9 sessions about adolescent depression. I think I feel pretty rabid about this. Teens are hard. I always say they should come with instructions because they're just a tough group. They're moody, they're experimental, they're rebellious, and it's really tough to know what part of that is normal and what it might be a mood disorder. Suicide is the 3rd leading killer of teens. Number 1 being accidents and number 2 being violence. And we don't know how many of number 1 and number 2 has to do with having a mood disorder.
That's right.
There's a lot of underreporting. So it's just absolutely vital that we start educating the public, and specifically parents and kids and teachers, that this is a real disease and it needs to be addressed These kids need to get into treatment so that, developmentally they don't get off track, academically, socially, etc. So hopefully the film's going to help. Hopefully the grant with these 8 schools will prove, through research, we're using statistics and methodology, that more education is better than less. And I do want to say this is not, we're not trying to set up clinics or anything of the sort. This is an education curriculum program, period. We are not trying to screen for suicide. We're trying to educate.
Educate about it so then the individuals who may be at risk or may be vulnerable can then reach out and get the assistance that they need.
Awareness heightened.
Well, obviously you all at DRADA are doing very important work, and unfortunately we are running out of time for this show. But I'm wondering if there is a number that you can give our viewers if they would like to get more information about your organization.
Yes, our number is 410-955-4647.
And let me ask you this. Do you have any final thoughts? What, if you had to think of one thing that you think it's most important for folks to know about dealing with the illness of depression, what might you want to say to folks out there?
I'd like to give them hope. It's a very treatable disease. Of all the mental illnesses, depression and manic depression are the most treatable. So I would ask them to seek out education and call us for support.
Thank you very much. Thank you for the important work that you're doing, and thank you for joining us here on Mental Health Matters. And I know that I feel hopeful when I know that people like you are out there working hard. And thank you, viewing audience, for tuning in again. And remember that if you or someone you know needs help with a mental health crisis, call Baltimore Crisis Response Incorporated 24 hours a day at 410-752-2272. And remember, your mental health matters to us.